Daniel Clary. I'm the Vice President of Education and R&D for AnteAGE. I have been in the aesthetic industry my entire professional career, 20 plus years now. I'm going to be 39 in October. So I've been doing this a long time. I've worked predominantly, I'm a cosmetic chemist by training. I've been doing this mostly on the formulation and R&D side of the industry, heavy on the research side of things, because for me, science trumps anything else out there. There's a lot of marketing and misinformation, especially in the aesthetic industry, and oftentimes brands are fueled more by marketing than by science. And so my objective, being a science guy my entire life, background in bio and chemistry, is to weed out the BS and present the actual true unadulterated science out there. Creating complete transparency has been my objective. So that's my passion. That's my mission, is to really be a part of what we call ourselves at AnteAGE. We're a team of truth seekers. So that's our objective. And sometimes I will tell you, we ruffle feathers along the way. But I find that in order to push this industry forward, we have to ruffle feathers a little bit, respectfully, of course. But if we're not ruffling feathers, we become complacent, we become stagnant, and we don't evolve and we don't innovate. So we're all about that.
Danny, I just wanted to ask you about AnteAGE and the background of the company, where it's located, and what it's known for.
Sure. Yeah. We have been in business since early 2011. We are a regenerative aesthetics skincare company. And basically, our entire technology is centered around stem cell science. It's one of the most advanced aesthetic technologies available today to really provide corrective and regenerative benefits to the skin. So basically, it is all centered around the proteins, growth factors, and cytokines, which a lot of consumers should know those terms. It's kind of a buzzword right now, specifically harvested from the adult bone marrow stem cell. And what we found in research from the past 2 decades plus of research is that cell source in particular is the most ideal cell to use when it comes to anti-aging, because the types of proteins that it produces are predominantly anti-inflammatory. And when it comes to aging, inflammation and aging are enemies. They do not like each other. And so in order to induce a true anti-aging response in the skin, we have to control inflammation. And so that's exactly what that technology does. And when we understand skin physiology, cell biology, it's actually, this technology is what your cells currently use to achieve and coordinate all of their current activity. So it's the best foundation of skin care that you can possibly use, and then building on top of that, adding all those other ingredients that we know. But that's the core of what we are. And we've been in business again since early 2011. We're a global company now.
Yes, yeah.
We're in multiple markets across the globe, across the country. We're based out of Southern California. Our lab is in Orange County, California, in Irvine. And that's where our PhD scientists are controlling everything, growing our cells, modifying their environment. So we have complete control over everything that they do, which is very important when it comes to this technology, because you can find brands out there that will get their growth factor media from, I like to say, a cell mill, if you will, just people pumping out these, not really understanding what they're doing. And then you can throw that in a product and call it a day. But if you don't really understand what's in it and its behavior and the types and proteins, both qualitatively and quantitatively in your product, you could potentially go down a path you don't want to go to. So it's nice that we control everything.
And then, there are different ways you can get the growth factors. I even heard from liposuction waste.
Yeah, so adipose or fat stem cells is another source of harvesting human growth factors. They do produce a lot of growth factors, those stem cells. So in certain areas of medicine, there might be value with utilizing adipose-derived growth factors. But unfortunately, in the anti-aging realm, it's not a excellent cell source to use, because while yes, those cells produce a lot of growth factors, they are predominantly inflammatory.
Exactly.
So it's one area where we raise our red flag. It's not even just the inflammatory proteins that those cells produce, but they also release a lot of metabolically active hormones like leptin and adipokines, which are significantly linked to metabolic disease and cancers, etc. So it just, again, it raises our sort of proverbial red flag. In the world of aesthetics and anti-aging, stay away from anything fat derived.
Yeah, so and I loved the products when we first brought it to Ottawa. We were the first clinic to bring it to Ottawa, so I'm really proud of that. And my clients have been getting really great results with the actual system, so the accelerator and the serum, as well as microneedling. So I wanted to ask you about home microneedling, as you recently started producing those kits, and the microneedling in studio. So the differences between the kits, and I guess I know myself, it's the depth of the stamp and the roller. So just tell me a little bit about why you would use one over the other.
Sure. So at the end of the day, that's the main differences between what you're doing at home and what you're doing in the clinic is the depth of penetration. So the needle depth is going to be shallow with your home treatments, 0.25 millimeters. And then your clinical treatments are deeper depths, anywhere from 0.5 millimeters up to 1 millimeter, or a little bit higher if you're working on some scar tissue. And then the solutions that you're using are different based on the concentration and the potency of the growth factor. So it's a lower dose for your home use, and then it's a much higher, more potent condensed dose in your professional side. So the beauty of the two is that they're very synergistic. There's a wealth of benefit to the skin when you shallow depth needle at home a couple of times a week, in combination with doing once a month clinical needling as well, because needling is such a great tool to reset your skin, if you will, to effectively reboot the cell's ability to behave in a young way, if you will. So constantly giving your skin a little bit of stimulation is actually quite ideal, especially this kind of stimulation, because with needling at any depth, it taps into the skin's ability to heal and regenerate with very little inflammation present, and that's what makes it so unique. So doing shallow depth needling a couple of times a week in combination with your professional depth really enhances the results of both. So for optimal clinical outcomes, if your patients are looking for the most effective way to induce anti-aging from targeting from all angles, the best approach would be for them to use our home microneedling kit upwards of 3 times a week, which would be ideal, and then coming to you once a month for their clinical depth needling. And then, of course, 85% of the picture is what they're using every single day at home for their daily skincare. We've got a great system that you sell. That's really giving the skin all of the nutritional tools it needs to maintain the benefits of both of these treatments every single day at home. So that trifecta right there is going to give your patients and your clients the best possible aesthetic outcomes.
Amazing. What is the microneedling for, and what does it resolve? So basically, the most beneficial reasons you would do microneedling.
Honestly, microneedling is great for everyone. It's great for all skin conditions, skin types. The beauty of it, again, is its main mechanism is to reset the skin rather than using lasers or other aggressive treatments that just create massive injury in the skin in order to induce a wound healing response. Microneedling goes in and it resets all of the main cells within your skin. So in the case of your epidermis, your keratinocytes, which are powerful cells involved in epidermal health, it regulates their function. Melanocytes, the cells that produce pigment or color, if there's overproduction of pigment, hyperpigmentation, microneedling can actually reset the melanocyte and restore its function so it produces an even amount of pigmentation. So it's great for pigmentation as well. And then for your fibroblast cells, the cells in your dermis that produce collagen and elastin, that's the holy grail of anti-aging, is can we get healthy collagen production? Microneedling does it very well because it does it by encouraging those cells to produce collagen versus forcing them via injury, strong injury and inflammation to do it. So the quality of the protein that's produced, the collagen, is much better for your skin. It's healthy, it's beautiful basket weave appearance versus fibrotic, warped, inflexible collagen that does get produced in the presence of inflammation. So lasers, etc., that's not what we want to produce. So again, microneedling is the most scientifically sound way to rejuvenate skin without going under a knife or a laser.
Yeah, I agree with that. And melasma clients, of course, rosacea clients, you have to go in a much shallower depth for that to work, gentle stimulation. And I've had really, really great results. So what depth would you suggest, and how many sessions would you suggest for rosacea and melasma clients, so sensitive skin types as well?
Yeah, I mean, there's a lot of variables there, and it really does depend on the patient and how they're presenting when they're in the treatment room. But on average, you're going to hover around the 0.5 millimeter range. If they present with a lot of inflammation in their skin, we actually prefer you to put them on our topical daily skincare for at least a few weeks. Just get that inflammation under control, and then introduce the actual professional treatment. And again, it can vary. So if there's very little inflammation, their skins look like they're ready to go for a treatment, 0.5 is your sweet spot. But if it's still a little bit questionable, they've controlled a lot of inflammation, but maybe that you're just not sure, 0.25 millimeters to 0.3 millimeters, which is shallow depth, but it allows you to just start that process of resetting the skin and balancing it out.
Perfect. Yes, and that's exactly what we've been doing with really great results. So who is microneedling for?
Everyone. That's the beauty of it. It's if you're somebody in a younger demographic and you're looking for preventative treatments, it is as preventative as it is corrective. If you're older and you've got more wrinkles present, you have more issues in your skin from a textural perspective, it's as corrective and as it is preventative. So it really is for everyone. And again, the beauty of it is it's when it comes to pigmentation is it's colorblind. So anybody that's a darker skin tone, or what we call Fitzpatrick, really, really dark skin tones, they are completely fine utilizing this type of treatment, unlike lasers or peels where there's a higher risk for post-inflammatory hyperpigmentation. With microneedling, that's not the case. It's designed for everyone. So that inherently anybody can get this treatment and yield phenomenal results depending on where they're at in their skin health. Yeah.
Awesome. And I wanted to talk to you about the new popular Netflix show, Skin Decisions, where they're using radio frequency with microneedling, which was featured in their show. What are you seeing as a trend with that machine, or what is it about? Do you think it's good? What are your opinions?
Sure. Yeah, it's a great show. I watched it through and through. I actually know Dr. Nazarian. I thought it was really well constructed, the way they tapped into sort of the psychological aspect of things and making sure that they were the right candidate, et cetera. But as far as RFMN, radio frequency combined with microneedling, it's very different than your traditional microneedling that you're used to with the automated pens that are sending those needles just into the epidermis at 18,000 plus RPM, very fast, just to create simple, slight wounding within that epidermal area, which is designed to stimulate that regenerative response. RFMN, which is basically needles that go in at not very fast RPM. They're going in at maybe like a second per pulse. The only reason those needles are there are solely, and they go much deeper. We're talking 2 to 3 to 4 millimeters into skin, all down to the subcutaneous layer. The needles are solely there to deliver that thermal radio frequency energy to that target site. Now, when it comes to, and this is my personal belief based on the research that's out there, that when it comes to anti-aging, lines and wrinkles, textural issues, regular microneedling still reigns supreme because it doesn't it mitigates any inflammatory response, and it doesn't use any thermal energy, which could have some downstream side effects to it. Where I see the RFMN devices coming into play is for skin tightening. So say the neck issue or the jowl areas where, yeah, we can get great textural improvements with regular microneedling, but if there's significant elasticity issues where regular microneedling is not necessarily going to give you the best results for that, and they're not ready to go under a knife, radio frequency microneedling could be quite beneficial there because it actually creates more tissue contraction and tightening of the area. So I think that's where I see it potentially having some benefit. But when it comes to just regular overall rejuvenation, I don't think it's the smartest approach for anti-aging because there is that thermal energy inflammatory component to it, which could lead to some unwanted collagen deposition, scar tissue, etc. There's a lot of variables there, but I still think that the gold standard with regular microneedling wins the day.
I agree with that. Actually, I've had some really good results for stretch marks as well, for acne scarring, because you can do microneedling on your entire body for anything, for surgical scars and just, the whole area. And
absolutely.
I think, that modality is just still, like you said, the best way we can get results with little inflammation.
Absolutely.
So another thing I was shocked to see on Instagram is people using chemical peels after microneedling treatments. So I just wanted to hear your opinion about that, because when I saw it, I thought it was actually quite shocking to even see that this is happening. So why would they do that?
The main reason is the mindset being the more damage we can create on the skin, the better the results will be. And that is so far from the truth. If you add a caustic agent like a chemical peel on top of microneedling, you are taking away from the actual benefits of microneedling, because microneedling, again, minimizes inflammation. It taps into this regenerative model of healing versus your traditional wound healing, inflammatory mediated type of healing. Adding an acid on top of that completely defeats the purpose. If your objective is solely because you don't really understand, maybe you're not that educated in skin science, if your objective is, I just want to burn the skin as much as possible, sure, do what you want, and hopefully you're not going to get any negative side effects. But if your objective is to tap into true regenerative pathways, please don't apply any acid to your skin. It doesn't make much sense, because microneedling is considered a wound. It's a mild wound, but it doesn't make any sense to pour an acid on a wound. If you were to get it cut, you wouldn't pour an acid on there, right? To heal it. It just doesn't make any sense whatsoever. So there's going to be people doing that. It's kind of a rogue industry. Everybody thinks that they're their own expert and they're going to do whatever they want, and they claim to see good results. But the problem with that is, and I'll tell you, inflammation, it's sort of this catch-22. Inflammation can actually produce what we consider to be results, because inflammation causes swelling under the skin. So if my skin was swollen, it doesn't have to be visibly swollen like bee sting, but edema, which happens in inflammatory scenarios, if that causes swelling underneath the skin, lines and wrinkles can somewhat appear to go away. They can simply disappear. So people will think, well, then that's results. Look at my wrinkles faded away. No, that's not the case, because it's a temporary result due to inflammation. As soon as you stop using any inflammatory ingredient or stop those procedures, you see a rapid decline in that protective extracellular matrix within the skin, and then a rapid perceived aging will be seen in the skin. So it's just not something that we encourage. So which is why any topical ingredient out there that claims to have benefits, or we see like amazing before and after pictures, I really encourage more due diligence on the practitioner side to dive deeper, if you're able to, into the medical literature and actually look at what these ingredients are doing, because you can go from A to Z, A being wrinkled skin, Z being no wrinkled skin, and get there via inflammatory pathways, which is not healthy for the skin, or you can get from A to Z, getting that no wrinkle skin in a regenerative anti-inflammatory pathway. So if that matters to you, which I really think it should matter to every single person out there, this is not some funny business we talk about when we talk about inflammation being truly harmful to the skin, especially long-term. Then dive deeper, ask more questions. Oftentimes clinical studies can be misleading. So it really requires the provider to dive deeper into the research and just make sure that how these ingredients are working are not because of underlying inflammatory pathways. That's just very important.
Yes, very important for sure. Another question. So to keep it simple for someone just starting out in their skincare routine, what advice would you give them?
Well, it's a great word, simple. I think simplicity is key. You don't need to, I see a lot of trends right now about adding, 10 different products twice a day, the Korean skincare steps, which it's all marketing. It's all a fad. As long as you're using the right ingredients in the right concentration and they're being delivered into the skin and you're consistent with that, that's what will yield positive results. So that's why we love our core AnteAGE skincare system. Is it's 2 steps, simple to use, twice a day. The only thing you add to that, which is also very important, is a solid cleanser to make sure you're creating a clean canvas for the skin, for your actives to penetrate. And then of course, for daytime, a well-rounded sunscreen. Other than that, that's really all that you need. And then of course, that's sort of like your nutrition for the skin is your daily skincare. And then your clinical treatments in the treatment room, or maybe weekly microneedling at home, think of that as your skin's workout, your boot camp for the skin.
Yes.
That's your workout, and your daily is your
Love
nutrition.
that. Love that, for sure. And I guess, what are the most common mistakes people are making when they're choosing skincare products or using them at home?
Yeah, sure. I think it's going too aggressive, using a lot of exfoliants, thinking that that's the answer to anti-aging. Let's just peel, 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 scrub the wrinkles away. And that's so far from the truth, because the most important component to your skin is your skin's top layer, the what we call the stratum corneum, or your skin's barrier. And it's our literal shield of armor from everything in the environment that can enter into our skin and cause aging and wreak complete havoc in the skin. So the number one ethos for aesthetic providers is protect the integrity of the skin barrier, the stratum corneum. The more that we break it down, the more that we exfoliate heavily, it becomes compromised, and instantly inflammation gets activated. And again, I can preach all day long about what inflammation does to the skin long-term and immediately. It's not pretty. So keep the barrier intact. Stop using aggressive exfoliants all the time. Use the more mild exfoliants if you're going to use them, and only 1 to 2 times a week, depending on the product. And stop abusing your skin.
Yeah, I see lots of clients come in. They're like, this is not working. What's happening? And then we ask them, what do you use for products? And it's a list of 15 things, and they're getting, chemical peels, microneedling, like just too often at different places where they don't communicate how many treatments they've done. So totally understand what you mean. Amazing. Thank you so much. This was really great chatting with you. And thank you so much for taking the time.
My pleasure. Take care, Yvonne.
Thank you. Bye.
Bye-bye.